everyone, my name is Shirley Fleury, and today I'm going to be talking to you guys about esophageal varices and its management. Now, before we get into this, I wanted to touch upon what cirrhosis is. And cirrhosis is basically an inflammation of the liver that is causing scarring, basically impairing the liver function. Now, with cirrhosis, complications of cirrhosis include portal hypertension, ascites and esophageal varices, jaundice, coagulation defects, hepatic encephalopathy, hepatorenal syndrome, and bacterial peritonitis. Now, what is esophageal varices? Esophageal varices is a result of portal hypertension in which the blood backs from the liver and enters esophageal and gastric veins. These varices are fragile and thin, making them easier to bleed when there's increased pressure. It is often present in the distal esophagus, but are also seen in the stomach and the veins and the rectum. Now, bleeding of esophageal varices is a life-threatening medical emergency, as bleeding can lead to severe blood loss, ultimately becoming hypovolemic shock. So for this presentation, this is for my visual learners who need to see so that they can understand, get a better grasp of what's going on. But for this presentation, this is going to be our patient, and his name is Tom. So Tom comes in, he's received an endoscopy, and we found some esophageal varices. So what we're going to tell Tom to do, because our goal is to prevent any bleeding, we want to be free from bleeding episodes. What we're going to tell Tom is to keep in mind some signs so that he can make sure to call his healthcare provider, to call his nurse, to call people on his healthcare team. And these signs would be hematoemesis, that's the vomiting of blood. Melena, that's the black tarry stools. And for those two, he can tell us how many times that this occurred, such as, I vomited twice today, I vomited 3 times. He can tell us those kind of things. And then just a loss of consciousness or a feeling of loss of consciousness, maybe reporting that he's feeling dizzy because, again, low blood volume is what's occurring. So, again, the goal is for the patient to be free of bleeding episodes. However, hemorrhage can occur, and as part of his healthcare team, it's important for us to keep up to date with interventions and different types of managements. Now, before we get into this, what can Tom do? Well, we're going to tell Tom, he comes in, he's been diagnosed with this, we're going to tell Tom, okay, I need you to refrain from increasing abdominal pressure. And that means no heavy lifting, no vigorous exercising, refrain from any chest trauma of any form, and refrain from eating hard food, as when it goes into the esophagus, it can rupture these varices, which ultimately, again, can cause bleeding. So that's what we're going to tell Tom. Now, as I said before, all patients with cirrhosis should be screened for esophageal varices by an endoscopy. Tom has already received an endoscopy. And that is what is used to detect bleeding before it occurs. Now, if patients have varices, we're going to go into our different management styles. So, preventative therapy. A preventative therapy that we can use is propranolol. That is a drug, it's a beta blocker, and it is used to prevent bleeding. It works by decreasing the heart rate and the hepatic venous pressure gradient, reducing the chance of bleeding. Now, if this doesn't work out and bleeding occurs, we're going to go into our vasoactive drugs and our endoscopic therapy. Vasoactive drugs such as vasopressin and octreotide are used to reduce blood flow through vasoconstriction to decrease portal pressure. Now, something very special about octreotide is that it suppresses the secretion of gastrin, serotonin, and intestinal peptides, which decreases GI blood flow to help pressure reduction within the varices. Now, endoscopic therapy. So when it comes to, if bleeding occurs, we can use our vasoactive drugs, or we can go to our endoscopic therapies. Our endoscopic therapies include variceal ligation and sclerotherapy. Variceal ligation, in this procedure, it involves the application of small bands around the base of the varices to decrease blood supply to the varices. So just imagine these varices. We're putting small bands. Hopefully Tom doesn't have as many as I've drawn in this picture, but small bands would go to decrease the blood supply, and that will help prevent the bleeding. The other procedure is sclerotherapy, and it's often known as injection sclerotherapy, and it is used to stop bleeding, in which the varices are injected with a sclerosing agent via a catheter. Complication with this procedure is mucosal ulceration, which can lead to further bleeding. So at this point, we're talking to Tom. The biggest thing, we're talking about all these procedures. We want to make sure that Tom knows the pros and cons, and he is able to weigh the risks for himself. And ultimately, we want him to be informed of all these different procedures. Now, if rebleeding occurs, we're going to go into our rescue therapies. And our rescue therapies could be, again, performing another endoscopic therapy, such as the variceal ligation or sclerotherapy, or it can be the balloon tamponade, or placing a stent, or shunting procedures. One that I want to touch upon is the short-term solution, and it's known as the esophagogastric balloon tamponade, and it happens with an esophageal stent. Now, the issue with this procedure is it has a life-threatening complication such as aspiration, asphyxiation, and esophageal perforation. The balloon is used to apply pressure to the site of bleeding. This form of therapy is used if the patient is unable to have a second endoscopic therapy. So if they're not able to get the variceal ligation or sclerotherapy, and then they're not able to receive the TIPS procedure, they are going to go into that procedure, the short-term solution, till we're able to find a way. Now, with the TIPS procedure, TIPS stands for transjugular intrahepatic portal systemic shunt. This procedure is used for patients that have not responded to any of these therapies that we've already discussed. Okay? In this procedure, a needle is guided through a sheath and pushed through the liver into the portal vein. A balloon enlarges the tract, and a stent keeps it open. Now, a big complication, or a big thing that we want to make sure that we are monitoring for, and we make sure that Tom knows to monitor for, like any symptoms, is for hepatic encephalopathy. And we've heard that as a complication of cirrhosis. So again, with hepatic encephalopathy, what's occurring is the liver is damaged, and then we have ammonia levels increasing in the body because the liver is not able to filter out the toxins. Okay, this leads to the marked confusion and ultimately to the coma state, right? So with this procedure, with the TIPS procedure, hepatic encephalopathy can occur. And this can occur because blood is now bypassing most of the liver's filtration process, allowing toxins to circulate around the body. Now, this can cause patients to have a decrease in level of consciousness and confusion, and ultimately can lead to a coma state. Same signs and symptoms as a hepatic encephalopathy. And just as that, treatment is the same. So when someone gets a TIPS procedure, they might be prescribed lactulose in addition in prevention or as a preventative measure of the hepatic encephalopathy. Lactulose is going to counteract the effect. Basically, it is used to cleanse the bowels and rid the intestinal tract of toxins that can contribute to encephalopathy. So that's basically what is occurring in esophageal varices and the management. I just want to briefly review again what's occurring, give you a short grasp of what's occurring. I am using an ATI book. It's a MedSearch book, and we're going to refer to page 353. Sorry, 357. So esophageal varices. It's caused by portal hypertension, which is elevated blood pressure in the veins that carry blood from the intestines to the liver. And it is caused by an impaired circulation of blood through the liver. Collateral circulation is subsequently developed, creating varices in the upper stomach and esophagus. Varices are fragile and can bleed easily. Again, the goal is for the patient, for Tom, to be free of bleeding episodes. So nursing actions, what we're going to do, we're going to assist with saline lavage, and that's the vasoconstriction, esophagogastric balloon tamponade. We're going to do blood transfusions, ligation and sclerotherapy, and shunts to stop the bleeding. Now, we're doing blood transfusions. Why? Because if Tom is actively bleeding, we want to make sure we're putting blood back in to prevent hypovolemic shock, okay? We want to make sure his blood pressure is staying up, maintaining at a healthy rate. Another thing the nurse is going to do, we're going to monitor hemoglobin and vital signs. And then again, ultimately, the goal, we're monitoring for bleeding so we can prevent this. So again, we have discussed what esophageal varices is. We have discussed interventions, management, drug therapy. So if you have any questions, please email me. Contact me if you have any questions, write me. But I hope you learned something from this presentation. Thanks for watching.